Madam Hadija webale olwakaddeko kati bw'oba ojjukira buno obulumi bw'olina ku mugongo bwava ku ki?
Omugongo gwatandika emyaka kati 3 guno omwaka gwe tulimu gwa 3 nga nina peyini eno naye sigamba nti oba kuva mabega nga nali ngiina wabula namala kuseerera nali nva mu nnimiro nga nina bye neetisse mu kiseera ekya covid nenseerera nengwa wenafunira peyini eyo naye saasooka giwulirirawo nawulira nsingo olw'okuba nti nali neetisse ensingo gye nawulira ne mugamba gwe nali naye nti ndabika nfunye obuzibu mu nsingo era nensuubira nti ensingo yange erabika egenda funa ki obuzibu nangamba kansooke nkukyusekyuseemukko osobole okuba nga okola ki osobola okudda mu embeerawo bulungi nnyo ennaku ezaddirira nga siwulirawo kintu kyonna ne ngamba ndowooza nja kubeera oke ebiseera gye byeyongera nga wayiseewo emyezi 3 namala kwoza ndowooza engoye oba zaali nnyingi oba olwa peyini eri olw'okuba nti teyajjirawo yavaayo nayoza bulungi nnyo engoye nenzimaliriza emirimu nengikola bulungi nengimaliriza okutuuka essaawa 11 ez'olweggulo nga ntudde nga bw'ogamba nti kati ntudde mpumudde buli kimu nkimaliriza nayinawo omugenyi eyali azze nga n'omwami akomyewo maliriza okubuuza ku mugenyi okusituka mbeeko kye ŋŋenda okumuleetera wallahi birayita layi nga sikyasobola ne mubuuza oba mbadde ki nga siteredde bulungi nzike wansi wallahi awo wansi saavaawo nga wayiseewo emyezi 3 omwami ye yankwatako naŋŋamba kati tukoze tutya obadde kyo oba olina ekyakkubye oba olina kye weekoonyeeko nga totegedde ne mugamba mpulira omugongo tegukyasobola ne nkubira sisita wange ne mugamba omugongo mbadde ntudde wano mu ntebe nakedde bulungi nga ndi mulamu naye ebintu bikoze eki ebintu bitabuse omugongo mpulira peyini y'amaanyi nnyo nnyo waliwo senga w'abaana omusawo bamuyita musawo Sophie nga mukubira essimu nga mugamba embeera eri bweti na bweti ng'asindika eddagala lye yasindika nga mirako nga ngamba naye kyetaagisa ki kyetaagisa genda mu ekisule tulabe obuzibu buli ki buli luddawa sooka omire ku ddagala eryo omale ennaku z'omaze nga 3-4 bwe kinaaba nga kigaanye then tulyoke tukole ki tulyoke tweyongereyo mu kifaananyi ekintu kyagaanira ddala ne kinyiinyiitira paka genda mu ekisule ogenda okunkebera ekifaananyi kigenda okuvaayo nga magumba ga eggumba eryawano nga lyekwata bwe riti kyakubiri layini ey'omu mugongo eno etuyamba okuva ku nsingo okudda wansi nga amagumba gamaze space nga tekyalinga bweyina kubeera nga gayimpayo ate mu bulamu obwa bulijjo omuntu okubeera ng'oli comfortable omugongo gwe gulamu bulina okuba nga joyinti zino mpanvu naye kati ezange zadda kaŋŋambe nti zayimpawa nga tezikyalina space emala kati omudokita naŋŋamba kati kyekikuviiriddeko obuzibu nali lyeggumba naye tugende mu maaso olina okubeera nga okozesa exercise okola exercise okubeera ng'osobola okubeera omugongo gulabika gwafunye eki gwafunye obuzibu naye bw'ona ogenda mu maaso ne exercise omusawo kyanaaba agambye ojja kubeerawo ng'oli ki ng'oli mulamu ne mubuuza ekibuuzo ngenda kuddawo nkola emirimu gyange nga bwe mbadde ngikola kubanga nga ndaba mu butuufu emyaka giba gyetemedde wansi mba ntunuulira peyini eri gye nabaddemu mu kwavula mu kukola ki wallahi oba tokyasobola n'ekikopo baba balina kikuweereza
kati awo Madamu Hadija bw'oba wakutunyonyola obulumi bw'olina ku mugongo buli bwa type ki olina sharp pain dull ache buno bulumi bubeereyo mpola mpola oba kijja kiringa ekiso
eri sharp bw'oba tonnafuna treatment musawo oba byakuwadde n'okutambula nabyo ng'ogenda nabyo mu maaso peyini ebeera eri high tosobola n'ekigero kisitula okukitambuza tosobola nkulayirira omugongo gwe guwanirira okutu kuyinza okuluma n'otambula omukono guyinza okuluma n'otambula naye omugongo we gumala okufuna obuzibu oba tokyalina kintu kirala kisobola kweyongerayo
mu bintu by'obadde okola by'obadde ozenga okukola mu bulamu bwo bintu biki byotasobola kukola okuba wafuna buno injury
nali nga nsobola ogenda okulima mu bitundu ebyenjawulo nga wala kubanga ndi mukyala akola emirimu gyonna egy'enjawulo nali mukyala musuubuzi w'amanda naye olw'okuba nali sirenga ntunda piisi kati oli bw'ajja mu kutwala siina gundi oba gazitowa gatya oba gafaanana gatyawo nteekawo nga njiwawo omubiri sinoonya bavubuka onaze okutwala nange nga tetunoonya mu butuufu ate nga nsubula kwalite kati awo nendaba ng'omulimu gwasanyalala yesi nasigala nsuubula naye ate nina okufuna omuntu ankwatirako sikyasitula kuba kati bwe kyatuuka n'ekidomolera sisobola kuba dokita yaŋŋamba bw'onoowuliriza bye nkugambye ojja kutwala ekiseera eky'omu maaso nga wooli otambuza emirimu otunuulira buli kimu nga bwe kitambula naye nga ggwe kennyini olina okwewa tayimu mu bintu by'okola ki by'okola oba obadde ositula ekidomolero ogenda kisalako ositula liita 10 oba ositula liita 3 olw'embeera okusinziira nga bwefaanana okutambula olina okuba nga olina beroti gy'oba osibye wano osobola okutambula wano ku kyalo n'otambula bulungi nnyo naye kati wali tosobola kubanga lwaki mu kkubo mulimu ampu oluusi toyina mmotoka kyakubiri otambudde olugendo luwanvu olina okubeera nga olina beroti ekuyamba okusiba amagumba gali okusobola okunywera otambule ng'onywedde kubanga buli lwebuuka ampu oba mmotoka oba booda payini ejjira ddala wali wennyini eno yonna togiwulira naye wali wennyini w'ogiwulira kitegeeza lw'otambudde ogenda kukomawo awaka naye ojja giwulira kiro bw'omala okutuula bw'otyo okomyewo oba omaze okulya otandika okuwulira wali obulumi enkya oyinza obutayimuka
Madamu Hadija ekisembayo kikyokubiriza abalabi baffe aba NTV bano bafuna obuvunne especially ne batagenda mu ddwaliro okufuna immediate treatment oba ne beekwekeyo mu nnyumba oba sito ne bamira panado ne babeera omwo
kyenyinza obbagamba nti kabeere mwana kobeere gwe maama oba taata bw'omala okufuna peyini eyo wadde towuliddeeko buzibu bwonna genderawo mu ddwaliro panado oyo peyini kiira naye aba tajjeewo kizibu kiri kiba kikola ki kibeera kiriwo wekiminizi kiyinza okweyongera ne kikola ki ne kikula nga tomanyi kati nze singa saayo zangoye ziri nnyingi kumanya nga njozaayo 2-3 sanditegedde buzibu era nandiruddewo okutegeera naye kyanyanguyira okumanya nti ekigo kiri kiyinza okuba oluvannyuma lwa gundi eri waseerera wagwako dokita ng'abimbuuza mu butuufu obwongo ne buzuukuka nti nagwa wayiseewo ekiseera bwe kiti embeera n'ebeera bweti naye siina kye nakozesa awo okusinziira nga bwe nnali naye mmaze kulaba nga mmaze kugwa kwe kujja wano ate era kwe kutegeera nti ekigo kyekiviiriddeko ki obuzibu buno kati mbakubira omulanga bonna aba NTV abandaba nti bw'ofuna obuzibu bwonna togamba nti sifunyeeko gundi emisinde wa musawo kuba osanga oba singa nagenderawo nenfuna ekisule sandituuse ku buzibu buno bwendiko oba kutuuka nti amagumba ago geekwata naye kati ku kiseera kino olwedde nina enjawulo olw'okuba nti saayimiriza basawo kye baŋŋamba nasigala ntambula ngenda nakyo mu maaso
A very good morning to you and a happy new week to you. From our team, thank you so much for joining us today. It's NTV Medical Matters. I am Viola Oxasia, and today we are talking about back pain. That was Hadija's story, her experience after such a huge fall that changed her life forever. So today we are understanding back pain, and we are joined by Ambrose Asimwe. He is a physiotherapist at Capital Center Medical Clinic in Bwaise. He's here to help us understand back pain and how it can be prevented or managed altogether. Very good morning to you, and you're welcome.
Good morning, Uganda and the rest of the world. I'm excited to be here to share with you about back pain. I'm Ambrose Asimwe, and I work with Capital Center Medical Clinic in Bwaise. Good morning.
Wonderful. So let's start off with the back in itself. When someone has back pain, say Hadija got a bad fall, her back was paining for a very long time. So what's really happening inside, say, the spinal cord from the top to the bottom? What's really happening when someone's going through that kind of pain?
And now the back is a big part of the body. When we mention the back, we mean the region of the body between the base of your neck and actually towards the top of your butt. Oh, that is the back. And the back has bones, what we call the spine. We have muscles, we have nerves, we have blood vessels, so it's a complex system. So any injury to one of the structures of the back I have mentioned, or to all of them, could bring about what we call back pain. Back pain, our viewers on NTV should know that back pain is different for everyone. What I feel could be different from what Viola feels. One could say, I feel sharp pain, stabbing pain, throbbing, burning pain. Very different for everyone, depending on the underlying cause of the back pain. Another thing to know is that back pain can affect all groups of people. The children, the young adults, the elderly. Anyone can get back pain at a certain point in their lives. Then another thing to know about back pain, we usually classify back pain into 3 groups. Okay. Like Hadija mentioned, she was mentioning about upper back pain, of course with some bit of neck pain. That is some type of back pain. But we also have low back pain. So we could have neck pain, upper back pain, and low back pain, all affecting the spine. So someone might mention, I have neck pain, I have upper back pain, and I have low back pain. But we shall see that low back pain is the most common type of back pain we have among our people in the communities. Why? One of the reasons could be that the lower back carries most of our weight. You see, like I'm here, like you're there, most of your body weight is taken on the lumbar spine, on the lower back. Okay. And still, whenever we are doing these carrying, lifting things at home, a lot of stress goes to the lower back. And that's why when you continuously use the lower part of the back, it puts you at a high risk of getting low back pain. So generally, we need to understand low back pain is most common. Is more common than the upper back pain. Though we still have people who are suffering with serious upper back pain. Another thing, just I'm giving you briefly to understand about the back. About back pain, you could have back pain when all the structures I have mentioned of the back have no problem, but you have some other underlying condition, like we shall see, like a medical condition. Your back is okay, but maybe you have some other medical condition and you get back pain. You go to the hospital, they check the back, they say the back is okay, but you still feel... How can our
viewer tell the difference between a simple back strain, for example, and a serious condition where they need to run to the hospital?
Actually, back strains are the most common causes of back pain in the whole world. Not a lot of diseases, just a strain. A strain is like an overpull of a muscle. A muscle is going to pull to some level. But if it goes beyond that point, you will get pain. That's called the muscle strain, muscle tendon strain. Usually it happens because of repeated movements, like maybe you are sitting in one position for so long. Of course, some other people have poor posture when they are sitting or standing. You are doing the same thing repeatedly over a period of time. So the repeated stress on the back could cause back pain. This is the strain of the back. It's a simple strain. The back pain might go away within maybe 3, 4, 5, 6, 7 days. But once back pain persists, it goes beyond 2, 3, 4 weeks. You need to see your healthcare provider. You need to see a doctor. Once back pain persists and the pain is becoming intense and it's getting more than 2 weeks, you need to see a doctor. People should stop this mentality of staying at home, taking some simple painkillers. I agree at one point they will help, because it's not good for someone to be suffering from pain all the time.
Yeah.
But once you have done all that, you have done the home care remedies, I will tell you, maybe just as time allows. Once you do the home remedies at home, you take some painkillers, and the pain is still persisting, you need to see a healthcare provider.
What are some of the causes of back pain from your experience that have been reported by most people who come to you? And how does lifestyle then influence this kind of pain?
One, lifestyle is actually one of the leading causes, leading triggers of the back pain. We shall find out from people who sit for so long. Prolonged periods of sitting, people who do office work, they're in the salon, they are doing tailoring work. A lot of sitting puts a lot of stress on the back muscles, and you're at a high risk of getting back pain if your work involves a lot of sitting. Then obesity. I'm going to talk about lifestyle first. Obesity, I'm not saying that obesity will cause back pain, but it puts you at a high risk of getting back pain.
Yeah. Because
when you are overweight, this weight puts a lot of pressure onto the joints, onto the spine, and you could get back pain. We have had women who put on high heels. Not occasionally, but most of their time. Because someone will say, but once I want to go for a party and I put on high heels for just 10 hours, will it cause back pain? It may not necessarily cause back pain, but meaning when your lifestyle involves wearing a lot of high heel shoes, you put a lot of stress onto the knees, onto the hips, onto the different joints of the back.
Yeah. And
this could predispose you to get back pain. Then you mentioned about what the patients usually complain of. The other common cause of back pain is injury. People could have their back injured following road traffic accidents. You're on a motorcycle, you are in a car, and there is an accident and you get a spinal cord injury. A spinal cord injury is life-threatening. It can even cause death, depending on the level of the injury, or paralysis, severe paralysis. Then, of course, pain. Spinal cord injuries can cause back pain. A broken bone, that is the fracture of the spine. A broken bone of the back can cause back pain. So when someone has a broken bone, I expect them to be in the hospital. You don't have to give just painkillers. Then people have come with back pain because of improper lifting techniques. Like Khadija mentioned, one time she was lifting some certain objects. And unfortunately, these people are carrying heavy objects. Khadija is around 60, 70 kilograms and is carrying heavy objects of more than 60 kilograms, and most repeatedly. This could put a lot of stress onto the back. Then the other thing is underlying medical conditions, like UTIs that are not treated, urinary tract infections. Urinary tract infections can spread to the kidneys. and this could cause inflammation and you get low back pain. I'm not saying that whoever has back pain, they have a kidney problem. And this is the common mentality among our people, that whenever I have back pain, I have a problem with the kidneys. Even if it's an infection, most of the times, by the time it starts causing back pain, probably it has spread to the kidneys. Then we have back pain among pregnant mothers. The pregnant mothers have also come to the hospitals because of back pain. Actually, more than 50% of the pregnant mothers complain of back pain. Yeah. They could have back pain during the early stages of pregnancy, that is the first trimester. Unfortunately, this pain could go on as the pregnancy progresses to the third trimester. We shall see that the most common cause of back pain among the pregnant mothers is we should look at the physical changes that happen because of the pregnancy. Yeah. There is the extra weight of the mother because of the growing fetus in the womb, that is the uterus. That puts, of course, that causes overstretching of the abdominal muscles. The abdomen is on the other side. It puts a lot of stress on the lower back. What should they do in that case, by the way? I'm really, really intrigued. We mainly know that we don't give a lot of medication to the pregnant mothers, yeah, and still they complain of back pain. But I usually encourage them to seek for antenatal physiotherapy services. Okay. However much we are saying we are not giving a lot of medication, which is not necessary during pregnancy, but antenatal physiotherapy is very important for these pregnant mothers. Because once the antenatal package, I think the medical team, the healthcare professionals who are listening should know this. Your antenatal package should include antenatal physiotherapy. Until the pregnant mother, whenever you go to the hospital, first find out there's antenatal physiotherapy. Is antenatal physiotherapy part of the antenatal package? Because this is going to address most of these concerns, yeah, like back pain, which doesn't need a lot of medication. The physiotherapist will teach you the different positions that could help you, that could give you a relief, or sometimes educate you about the different massage techniques that could be done maybe to your lower back. And in most cases, this has helped most of the pregnant mothers. Apart from pregnant mothers, most of the causes that you said are artificial or are external. But you mentioned nerves, you talked about different parts of the body, of the back. So in a case where someone has not had a fall, but they have constant back pain, what is happening and what can they do? People could have back pain when they have not had a fall. Maybe because of ongoing changes in the spine. When I talk about the spine, I mean omugongo. The spine is the amagumba gomugongo. Okay. The spine is not the spinal cord. So what is the spinal cord then? The spinal cord is olkizi. The spinal cord is very protected within the spine. Like you see, we have the bones of the skull, and inside we have the brain. Now we are talking about the spine. Then inside somewhere we have the spinal cord. Okay. So some people have back pain because of issues with the spine, not the spinal cord. So people could have ongoing changes within the spine, especially the elderly people. That is maybe wear and tear changes because of aging. Yeah. As we age, that is 45 years and above, there are wear and tear changes that happen in our bones. The cartilages, of course, the cartilages are these cushion structures that help with the friction. So once we start aging, there is wearing off of the cartilages of the spine, and this could cause back pain, what we call degeneration. It was actually what we call arthritis. It was a part of one of Hadija's questions that I'll be bringing to you later. But right now we're going to take a break. When we return, we shall be talking about treatment, management, as well as what to do in case you have pain that you don't understand in your back. You're watching NTV Medical Matters. We are going for a quick break, but do stay with us and be reminded that our social media is airing the show right now, NTV Uganda, and we shall be having phone calls as well, so prepare your questions. We shall return shortly.
That break. Thank you so much for staying with us. And if you're just joining us, it's NTV Medical Matters. I am Viola Sasya. Today we are talking about back pain, and to help us understand further, we have Ambrose Asimwe. He is a physiotherapist, and he's the right person to talk to us about it. You can call in later and ask your questions directly to him. So we're going to talk about treatment and management. But before that, I just wanted to put emphasis on some of the things that happen to the back that are not injuries, that are not, they don't have an explanation almost. I just need our viewers to understand that. What are they?
The viewers of NTV should know that it's not easy to tell the specific cause of back pain on your own. You could pinpoint a moment where you had an injury, for example, when you twisted your back, or when you were carrying a heavy object. But other times, back pain might start without a clear trigger. And that's why it is important for us healthcare providers to assess, examine the patient and know the real cause of back pain. We have seen people who have had back pain because of tuberculosis, TB. You have not had any injury, but you didn't know that you have TB. Most people know that TB only affects the lungs, but TB can be spread to the other parts of the body, and that is the spine. And we have seen patients who have had serious back pain because of tuberculosis, Pott's disease. Then we have had people who have had back pain because they have cancer. Cancer can spread to the spine and cause serious back pain. People should know that. Then among children, I must talk about it, because the truth is back pain affects more than 20% of the children between 10 to 19 years. And the parents find it hard to accept this, but they should understand that there are several causes of back pain among their children, which could be, of course, that is lifestyle, carrying heavy packs on their backs, like the school children. But some of them could have arthritis, juvenile arthritis. Some of them could have tumors, and you don't know that my child is complaining of back pain all the time. But to check, to come into the hospital, to examine the child, we find out that the child has what? A tumor. Then we have people who take a lot of cigarettes and heavy drinking. The substances in cigarettes interfere with blood circulation. So most of the time, a person will complain of back pain, and when they go to the hospital, they say the X-ray is okay, but this person is taking a lot of cigarettes because we have interfered with blood circulation. And blood circulation is important for most of the structures of the back. And this could predispose this person to getting back pain. Yes.
What are some of the home remedies that can ease back pain, and especially the light kind? And what is some of the treatment that you give in the hospitals and clinics? But also there is a myth about sex, that it actually helps alleviate back pain. What would you say about that?
To start with the myth about sex drought causing back pain, indeed that is a myth. Most Ugandans wrongly believe that once you take time without having sex, you will get back pain. That's not true. I think this is the concept. You could have some mild back pain, some discomfort because of increased tension in the back muscles. And whenever you have sex, you feel some relief.
Isn't that exercising?
That is exercising. So people, after getting a relief, after having sex, they will think, oh, maybe I have been having back pain because I was not having sex. Then the home care remedies you could try at home for the mild back pain, because some mild back pain will disappear on its own. Or maybe using a little remedies at home, like applying a warm cloth to your back, that is a warm compress, or what you might call a heating pad if you have it at home. Maybe some simple exercises, simple stretching exercises It could even be at home, inside your house, or just outdoors. They could be enough to relieve most of your back pain. Then play around with positioning. If you felt back pain, especially in the morning, and you notice that every day early in the morning I feel some kind of back pain, maybe it could be due to poor positioning in the bed. So maybe you have some changes. You lie on the sides, or you lie on your back, you use pillows. It could give you that comfort. Then proper lifting techniques. Involve your knees when lifting. Not necessarily all the time using your lower back, because it puts a lot of stress on the back. Then a simple massage to your lower back. A simple massage, not advanced manipulative techniques, but a simple massage, maybe if you're helped by your partner at home or some other person, a guardian, you could get some relief. So those remedies are enough to give you some relief. But once you have done all this and you have back pain that persists, and this back pain, for example, is paired with unexplained weight loss. Now I'm telling you when you should come to the hospital.
Yeah.
When your back pain is paired with unexplained weight loss, fevers, chills, weakness of the leg muscles, you feel you can no longer move. Your leg muscles are weak, they are so heavy.
Yeah.
You don't feel most of the parts of your lower body, that is from your back downwards. All this back pain is spreading to other parts of the body. You could have back pain that is spreading to your butt, to your hips, to your legs.
Oh, yeah.
We have sciatica. Sciatica is another type of back pain, and very common, and people are really suffering from sciatica. So if you have this kind of pain, or you have had back pain following an injury, you fell down, you have seen it yourself, you've had an accident, don't keep at home.
Yeah.
You need to come to the hospital, and we do thorough assessment. So when these people come, we do an exam, a physical exam. Of course, we find out, like Khadija mentioned, the doctor tried to ask some questions. How did it come? Because there's back pain that comes gradual, and there's one that comes suddenly. How does it feel? Then the doctor tries to palpate most of the structures of the back to see, is this area so hot? Do you have any deformities of the back? Because I didn't mention, but deformities can also cause back pain, like scoliosis. Omwana nga yewesemu, omuntu alinga ayina ebbango. Scoliosis, kyphosis, lordosis, all those deformities of the spine can cause back pain. So we try to look out for that. Then after all this, the doctor will see, is there a need for us to go for an X-ray? So Ugandans should know that not all back pain sufferers need an X-ray, need an MRI scan. You could go for an X-ray or an MRI scan and they tell you that you're okay, but you still have back pain. So it's the doctor to identify the need for an X-ray or an MRI scan. So after a physical examination, we shall find out, do we need to go for an X-ray? Do we need to do an MRI? To investigate more about the pathology we have seen so far. So then once we identify the cause of the treatment, the cause of the pain, the treatment depends on the underlying cause. Treatment is different for everyone. The treatment that worked for patient A might not work for patient B. People should understand that. Someone told you, for me I went, they gave me only painkillers and I was okay with the back pain. But some people have had back pain and the painkillers cannot take away the back pain. Yes, they are giving some relief, but the back pain persists. Maybe they need other forms of treatment, like physiotherapy.
We're going to talk about physiotherapy, actually. When does it come in? What does it look like? And how affordable is it? But I just want to let our viewers know that you can call in and ask your questions about back pain. So let's go ahead with the physiotherapy. My bad.
Yeah, physiotherapy is one of the most important treatments for your back pain. Back pain is not a disease. Back pain is a symptom, just to remind you. So we need to treat after having known the cause. So physiotherapy doesn't include use of medication. It includes use of physical treatments like exercise, that takes the most percentage. exercise, I don't mean just moving around or just going to climb the hills, but this exercise is prescribed by a physiotherapist. It's a trained personnel who has had enough training, has the skills to really manage your back. If the cause of your back pain maybe was stenosis, maybe you have reduced disc space like Hajat mentioned, Hadija. So the physiotherapy exercises that are given are really helping us with this reduced disc space such that the pain can go away. Because we might be complaining of back pain and just from nowhere and we start getting paralysis. So physiotherapy helps. It involves exercises. It involves some manipulative techniques.
I will interrupt you. We have a caller that is trying to reach out. Medical Matters, what's your name and your question? I think we lost that one. So
I was saying that.
All right.
Hello.
Yes, please. What's your name and what's your question? Yes, Annette. Okay.
Naye nina obulumi bw'omugongo naye nagenda mu ddwaliro bagayawukana kati mbadde mbuuzaako dokita kati bankozesa exercise bampandikira eddagala nkola exercise naye kitwala bbanga ki okwonga okutereera
Kale Annette.
Okutereera, now it will depend on the severity of the injury or ekizibu ky'alina. Ekizibu ky'omulwadde ono kyenkana now I'm trying to answer her. So tajja kumanya bbanga ki naye ebiseera ebisinga omugongo nga teguli severe, ebiseera ebisinga ng'ofunye treatment entuufu within 2-3 weeks oba otandise okubeera better. Naye waliwo abantu, there are people who have been on treatment for so long, depending on the cause of the pain, because someone might have back pain, but they have other underlying conditions. They have cancer, they have diabetes, they have hypertension. All these affect greatly the progress of the treatment. Nayenze mwamagezi oyo abadde atukubidde nti takowa asigalinga akole exercise even at home.
Okay, so we have another caller. NTV Medical Matters, your name and your question, please.
Hello.
Hello, speak up please, your name and your question.
My name is Grace.
Yes, please.
Hello.
Yes, I can hear you. What's your question?
My name is Grace.
Yes.
I have a problem with the back and it has taken some time, like long time.
Okay.
I went for some checkup. And then they told me like the back is hollow, or it has no marrow inside, and then it comes to the root. So when they did the X-ray, they said that our ligament in that connects the rib is also reduced. So I don't know how best can I help myself, and it's persistent. It has taken like 5 years now.
All right, thank you, Grace. So how can Grace get better?
Grace might need some medication, maybe some back support or physiotherapy. So I would encourage her to go for some current physical assessment, maybe preferably a physiotherapist, because she has done an X-ray already. I didn't understand what she was trying to bring out. But there are people who go for back checkup and they mention that the curves of the back have had some changes.
She's actually saying that the tendons have reduced between her bones, and that how can she increase that again?
Not the tendons.
The ligament? What is it?
They usually, you see, between the two vertebral bones of the back, we have what you call a disc, the intervertebral disc. So usually when people mention about the heights, the space, we are mentioning about these discs. Because when there is compression, it could cause back pain. It irritates the nerves right from the spine. Those are the spinal nerves. And this could cause back pain or sometimes paralysis.
So how can office workers help themselves? And what other lifestyle changes can help someone, avoid
office workers, they should know that we shouldn't sit for more than 1 hour without doing some stretching exercises. You can stand in your office and maybe do a part together or move around. You see, yes, we are busy. We want to finish all this work on time, but health is very important. You might fail to do your work when you have serious back pain. Then still, proper sitting positions. When you're holding your phone, when you are having a screen of your laptop or computer, the screen must be at eye level. The position of your shoulders should be taken care of.
So we're interrupting you. We have a caller. NTV Medical Matters says, yes, please. What's your name and your question? We can hear you. What's your name and your question? I think we can hear you. What's your question?
Good morning.
Good morning. What's your question and your name?
I'm called John. I'm Mama Papa.
Okay.
Doctor, thank you for your teaching.
Welcome.
I appreciate you a lot.
You're welcome. What's your question?
One day I experienced hurt when I was pregnant, and it led me to
Okay.
7 months. So right now, I still have that back pain. Up to now, I feel like my the left part of my body, sometimes I don't feel straight. I feel like, I don't know how to explain that.
All right. Thank you.
Yeah.
I had
about that.
pregnancy, having pain. We mentioned one of the causes, but the other cause, as the pregnancy progresses, there is what we call relaxin hormone. Relaxin hormone is usually produced in the body, and it helps with this.
We have someone else. NTV Medical Matters. What's your name and your question?
Hello.
Yes, please. I can hear you. What's your name and your question?
Hello.
I can hear you.
Hello.
There must be a challenge there.
Relaxin hormone softens the ligaments of the pelvic area, softens the joints. Actually, it does what people think is called okumenya when mothers are pregnant. And this puts a lot of, this brings out a lot of inflammation in the sacroiliac joints, the joints in the pelvic area, and this could cause serious back pain among pregnant mothers.
Yeah.
Then she also mentioned the pain that moves down the leg. Because of pressure onto the nerve. Actually, some people are told that the baby is in the leg. The baby is never in the leg. That is abnormal. But the pain is coming somewhere from the lower spine, and the pain is spreading down the leg. That needs physiotherapy. We have another call?
Not yet. We don't have another one.
Yes. Then what I had forgotten is about these young girls, especially senior one.
Yes, please. What's your name and what's your question?
My name is James. I'm calling from Tanja.
Yes, please.
And my question is, I have lower back pain,
Okay.
which normally intensifies when I'm standing up for a long time. It actually becomes so tough that a short while after it can hardly bend. I feel this pain in the mornings when I wake up, and then thereafter it disappears. Then when I stand up for a long time, I feel so like I become stiff. I can hardly bend.
Okay.
So how can I alleviate this pain?
All right. Thank you so much for your question. The pain while standing and not
One
being
of
able
the
to
causes
bend
I have
again.
seen, according to my experience, is weak, tight muscles. Weak, tight back muscles. Some people have this back pain that is stubborn, that gets worse with some positions and gets better with some positions because some muscles are weak and they are tight. So yes, they could need some medication, but when they have these muscles strengthened for a number of weeks, they get better. So I would encourage the gentleman to go for physiotherapy service.
All right, so...
By the way, weak muscles and tight muscles can cause serious back pain. And you go for an X-ray, they tell you the bones are okay. You know, people think whenever you have back pain, the bones have a problem. But these muscles, when they are tight and weak, you could get serious back pain. So the idea is work on the strength of these core muscles that are very important to keep you in the gravity position. They are anti-gravity muscles.
So I think when we have more phone calls, I'll be picking about 2 to 3, and then we answer at once.
Exactly.
But for now, let's talk about some of the myths that you've heard about back pain and you would love to correct today. Since we have the
People think back pain is only among the elderly. That's wrong. I want to make it clear on NTV that we have young children, even 7 years, 6 years. Actually, I was doing some research and I found out that even you could have back pain among children who are 5 years and below. Then, another myth, of course, we talked about it. I talked about it, that lack of sex causes back pain. That's not true. Actually, it could be this. It could be when you have back pain, it could affect your sex life. Let's make it clear. When you have back pain, it could affect your sex life. But we have had people who have had back pain with underlying other factors like erectile dysfunction. So we need to find out the real cause. Then people think back pain happens when you skip some traditional medicine.
I've heard of hot spring. Does that work?
There's no scientific evidence that brings out that.
Okay.
Then there are people who think whenever you have back pain, you have a lot of water. That's not true. I'm talking about the common misconceptions among our people in the communities. So we need to understand that back pain is a symptom, and it can be caused by physical factors or underlying medical conditions. People should know all this. Yes.
So what advice would you give out to our viewers to maintain a healthy spine and spinal cord?
To the large extent, I would talk about posture in whatever we are doing. Posture, actually, for you to understand what I mean by posture, is the position of your body when you are sitting, when you are standing, when you are walking. The alignment of your head with the shoulders, with the hips, with your feet. How are you sitting? How are you standing? Then, I can't leave out the point of hydration. You keep yourself hydrated at all times, because what you didn't know that the discs of the back, the discs act as the shock absorbers of the back. They mainly comprise of water. So take a lot of water. That's why we have these long distance travelers. You understand those people. We encourage them to take a lot of water. Then still, exercise to keep fit. You need to do exercises on a daily basis to keep fit. Find time and do exercise. Then a simple massage once in a while to relieve tension. Then the other thing you need to know is manage your stress. Stress can trigger back pain, because stress can affect your mental health, can affect your musculoskeletal system, in that it causes tension that develops in the muscles, and you get back pain. So when you manage your stress, you could also have a healthy back.
All right, so we've run out of our time, but it's really been very good to have you here talking about back pain and explain to us more. So I'll give you an opportunity to say any last words or any information you think should go out there about back pain and your contact. Where can our viewers find you to get services?
As I conclude, I want people to know that men also suffer from back pain. But we don't usually see men in the hospitals. They will tell their women to go for the help in the hospitals. But men also suffer out there. I understand we want to be strong because we are men, but trust me, we are so weak. So don't wait. You could have back pain maybe because you have a prostate health problem and you don't know. Please, men, you need to embrace hospitals. Then for women, they have been trying, they should come. Don't wait for the back pain to put you into restrictive environments that you can't move outside the house, you can't get out of the bed. Don't wait for that. For more clarification, for more discussion about the back pain, you could call my number, and that is 0706 63 9950. I repeat, is 0706 63 9950. Asim Ambrose, find me at Capital Center Medical Clinic in YC. Thank you.
Okay. So our viewers have heard from the horse's mouth. I won't have to repeat anything, but rather to say that we've come to the end of today's episode of NTV Medical Matters. We're supported by Bill and Melinda Gates Foundation. I am Viola Sasira, and from the team and I, we wish you a wonderful week.